The notion of a national vaccine registry has been talked about for decades. The debate is one that comes roaring back into the headlines every time there's an outbreak. This time, it's the measles in New Brunswick. A national vaccine registry could be a central place for anyone to look up their vaccination records. This would come in handy for people who have moved between provinces or for those who have lost those old immunization books. But beyond the obvious, those for a registry say it would be a significant data source. Provinces currently manage their own vaccines and schedules. A national registry could help form results showing which ones are most successful. Using that same information, public health officials could host pop-up vaccination clinics in areas with low immunization rates. When it comes to the measles, a whole generation might benefit from having a registry. People born in the 70s and 80s were typically only given one dose of the vaccine. Two became the norm later to secure lifelong immunity. A last resort blood test can prove immunity if people of that generation have no clue what they were given, but often doctors will just give an extra booster shot as a precaution. So in light of all of this, a national registry seems like a logical solution, so why hasn't it caught on? Well, one of the biggest obstacles here is that healthcare management falls under the responsibility of the provinces, and ultimately a national registry would need leadership from the feds. The provinces would have to switch to a uniform national approach to vaccinations and schedules. Someone's got to pay for it too, and a national registry would be expensive to set up. There would also be privacy implications as well, which is always a complex challenge to face, especially as you're dealing with millions of healthcare records. What could cause movement forward on a national registry? Public health officials have been working on this behind the scenes for years, but some believe it will take a major outbreak of a disease to finally convince officials to make it a reality. Since it's unclear if a national registry will ever happen, public health officials recommend you use a smartphone app to keep track of your family's immunizations.